And now, with our final session of the day, medical tourism transforming the business of health. It will just start after 5 minutes.
أنا أتمنى بس هو الموضوع مش هيتظبط بهذا الشكل لأن في ناس تطول في ناس هتأثر.
تمام أنا بس بقول لحضرتك تشوف
المفترض إن كل واحد فيهم هيقف.
ده ساعة أساسا يعني ساعة كده مش لازم نستخدمها ستوب ووتش أي حاجة.
أنا هبص في ساعة
كده ستارت لو حبيت كده ستارت كده بوز وكده ريسيت ستارت ريسيت لو حابب مش حابب
هسيبها هنا معايا احتياطي وانا برمو معايا الساعه. طيب لا انا هعمل نفسي كده في كلمه صغيره مش Okay.
Welcome to our first final session. Please note to keep your phones on silent mode and avoid side talks. And now, with our last session, Medical Tourism, Transforming the Business of Health, presented by Dr. Fawzi Al-Hamouri, Dr. Ashraf Ismail, Mrs. Angelique Katsapi, Mrs. Laila Al-Jasmi, Mr. Muhammad Al-Miheri, and our session chairman, Dr. Asaad Riad.
Hospitality logistics. And luckily, you find an authenticated team who believe in customer service. You start to gain a trust of international buyers, patients, and you start to export your services international tourism. Medical tourism is part of a huge umbrella of health tourism, which includes, in addition, wellness tourism, senior tourism, accessible tourism, and many more. Health tourism has been evaluated by IATA as a market of more than 3 trillion to reach this success. What to avoid in our pathway, how to orchestrate all stakeholders involved in this complex industry. This is exactly what we will discuss today with our distinguished speakers who came from many countries to tell us their touch assistance company, a company that work in medical travel assistance and medical tourism for more than 15 years in Egypt, in addition to my role as a regional office director and certified assessor in TEMUS International. Let me start to invite Dr. Fawzi Al-Hamouri, Chairman of the Private General Authority of Healthcare Accreditation and Regulations, Gahar in Egypt, Mrs. Angeliki Katsabi, TEMUS Director in Greece and Cyprus, Mrs. Laila Al-Jasmi, Founder and COO of Health Beyond Borders in Dubai, and Mr. Mohammed Al-Meheri, Director of Health Tourism Department, Health Regulatory Sector Dubai, Health Authority in Dubai. Then after
بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد خاتم الأنبياء والمرسلين. قبل ما أبدأ المحاضرة بحب أشكر ومنظمي المؤتمر Africa Health ExCon وأشكر الدكتور أسعد وأرحب فيكم جميعا. موضوع الهيلث كير ترافل it's a big industry, as Dr. Asaad mentioned, and today we want to talk about the wide scope of healthcare travel. Okay. What's healthcare travel? There is a definition according to the UNWTO. So it covers all types of travel. Sorry, احنا عندنا مشكلة في البوينتر شباب. Yes. So it covers إنه يسافر to contribute to the physical and mental and spiritual health. Through what? Through medical and wellness activities. For what? To increase the capacity of this individual to satisfy their own needs and function better as an environment and their society. عشان هيك بيسافر، يروح يتعالج، بده يعمل wellness, whatever the reason why he travel. This is the definition of healthcare travel. So if anyone travel for any of these criteria, he can be considered as part of healthcare travel. Technology دائما عندنا مشكلة. It's not only hospitals and doctors. There are more than 40 sectors that are involved in healthcare. Only for healthcare providers. If we look at the size of the economy of healthcare travel, دكتور أسعد عندنا مشكلة بالبوينتر. Okay. Okay. The Global Wellness Institute, they estimated the wellness economy at 4.5 trillion US dollar. The wellness tourism part is 630 plus billion US dollar. The medical tourism part of it is 100 billion. In Jordan, we announced what we call Amman Declaration, HT8, Healthcare Travel 8 segments. And this was announced in 2017 in a big conference. It was the Global Healthcare Travel Forum, which was hosted in Jordan with more than 650 participants from 42 countries. And we agreed in that forum to announce Amman Declaration that healthcare travel is constituted of 8 segments. What are the 8 segments? Well, first of all, it's medical tourism, which you all know, and we will talk about it later on. But also we have dental tourism, spa tourism, wellness tourism, culinary tourism, assisted residential tourism, and accessible tourism. We talk about medical tourism, and I was asked to talk about Jordan experience in that. Of course, in medical tourism, there are more than 30 destinations. Of course, Egypt is one of them, Dubai is one of them. So many countries around the world now are considered medical tourism destinations. Jordan is a small country with a 10 million population. It's open to the world. Jordan is considered #1 medical tourism destination in the MENA region. Before COVID, we used to receive more than 250,000 patients a year. Why Jordan? Jordan is known for its great hospitality in its open country, high level of security and political stability, and good diplomatic relations with almost all countries on earth. There is no language barrier. Most Jordanians speak more than one language, 2 or 3. And we have the largest natural spa on earth, which is the Dead Sea. Jordan has been known from the 70s of the last centuries, when we had the first open heart surgery in 1970 and the first heart transplant in 1985. So the focus was put in Jordan as a center of excellence in so many procedures. The first IVF Arabic-born baby was born in Jordan. So from the 70s and 80s of the last century, Jordan started to attract patients. Of course, if you need to be a destination, you need requirements. One of those requirements, you have to have good hospitals. So many countries have good hospitals, but this is not enough. Medical technology, again, is available. Most countries can buy medical technology. Quality and accreditation, I will not talk about it because we have the experts here. Timos, Jahar, Dr. Ashraf. He's a pioneer in accreditation in the Middle East, so I will not talk about that. but I have to stress that it is important, because if I'm a patient and I want to go to a hospital in a certain country, I want third party to tell me that this hospital is providing quality care, because as a patient, I cannot assist that hospital. Qualified personnel. I think this is the key. The patients look for doctors. They look for medical professionals. There is no point if you have good hospitals, big hospitals, very good technology, if you don't have the manpower to use these facilities and these machines and to provide a good care for the patient. So at the end, Jordan invested in healthcare professionals. We have the highest ratio of doctors per population. No waiting time. This is important because if I'm a patient leaving my country, going to another country, there is no point in waiting to see my doctor, in waiting to do my procedure, in waiting to do my surgery. I don't have the luxury of waiting as like the patient who is living in that country. So the waiting time is a killer for medical tourism. Cost. Cost is very important. This study was done in the US. They asked about 10,000 people and they said, if you save more than $10,000, would you travel abroad if you are going to a country with high quality of care? 40% said yes. So the cost is important. So you have to be conscious about the cost of care that patient has to pay. Of course, we had to adapt to the situations. In Jordan, we were the first country to open for COVID, for patients during COVID. And we announced the Salamtech platform, and usually need a platform which is a national platform to monitor and simplify the process of patients coming into your country. Jordan won the destination, medical tourism destination in 2014. Again, Egypt, yesterday we heard a lot about your achievement in treating the hepatitis C, and we heard the President Sisi so proud of what you have done. I think this is something that you can build on. The second pillar is dental tourism. Dental tourism, again, is an important segment, and so many people around the world, they do not have insurance for dental care. So I think this is important to work on, and dental tourism is expanding more rapidly than the regular medical tourism. A lot of saving in dental tourism, and especially in those related to the plastic care that's provided by dentists nowadays. Spa tourism. Spa is derived from the Latin phrase salus per aquam, which is health by water. يعني عندك المياه المعدنية، المياه السخنة، وفي عندك ثلاثوثيرابي اللي هو استخدام مياه البحر. وفي الأردن احنا عندنا ميزة إنه أملاح البحر الميت can be used as a treatment. يعني هو مش بس سياحة عادية واستشفائية. Actually, it's a medical. So there are patients who come from Europe to be treated for certain diseases in Dead Sea, like psoriasis arthritis, mycosis, and lichen planus, and so many diseases are treated by the Dead Sea products. So it is a spa tourism, but also it is part of it is medical. These are some of the spas in Jordan, and I know that In Egypt as well, you have many of those. These are some examples from Egypt. Wellness tourism, again, we mentioned that more than 600 billion is the economy of wellness tourism. So again, this is quite important industry that you should work on. Meditation, yoga, and so many other things. And I am sure that in Egypt, you have so many places that can fit for wellness tourism. Are you familiar with this Siwa sand bath? Yeah? Dr. Asaad, I'm sure you know that. Culinary tourism. Well, what's culinary tourism? It's a healthy food tourism. Actually, people travel to eat healthy food because if we know that 80% of chronic diseases result from wrong dietary habits and poor physical exercise. So now people are traveling to do detox, to get rid of what? Drugs, alcohol, nicotine, treat hypertension, treat diabetes, treat obesity. So culinary tourism is again something growing and we should be aware of. Some examples of detox resorts, culinary tourism again. Sport tourism. How many people travel to do sport? Whether diving, hiking, marathons, any kind of sport. Why they do travel for sport? Because they are keen about their health. So it is part of healthcare travel. And again, you have so many activities in Egypt that you could promote for sport tourism. Assisted residential tourism, this is a new trend. So many people, senior citizens, that want to retire in a certain place, but that place must have certain criteria. If I am 75 years old and I want to spend a few years of my life in a country, I want to make sure that this country is providing me a good health care if I need it, and provide me safety, and has to be easy for me in that particular age to spend 1 year, 2 years. And there are so many destinations in Europe and some Arab countries are working on this. So again, assisted residential tourism, and these are some of the resorts in Jordan, and some of them are in Egypt that are very appropriate for this kind of tourism. And finally, the accessible tourism. Accessible tourism is tourism for all. If I am a person with a special needs, if I am a person on a wheelchair, is your country, is your facilities appropriate for me? Can I come to your country or not? So there are certain requirements that the facility, whether touristic area, whether hotel, whether conference hall, it has to be adjusted and has to be appropriate for those people who have special needs. And the size of this industry, according to the WHO, that 1 billion of the populations of the world have some sort of special needs. 1 billion. 15% of the world population have special needs in a way or another. So access has to be accessible. Transport, spas and wellness areas, and we mentioned touristic, airlines, buses, all has to be accessible to be able to be tourism for all. Your country can be named as a country that is accessible. So this is important. These are some of the accessible areas in Egypt. Take-home message: expanding the healthcare travel scope is essential for any destination aiming to attract more visitors. Implementing Amman Declaration HT8 is an important tool to do that. You have to bring all stakeholders on board. You cannot do it alone. Healthcare travel is one of the fastest growing forms of tourism. Finally, we are organizing a big forum in November in 2022 in Amman, Jordan, and we look forward to see you in Amman. Thank you very much.
Thank you, Dr. Fawzi. We will postpone the questions till the end of presentation, so we will have an open discussion together. Now I am inviting Mrs. Angeliki to have her presentation.
I use this one.
حبيب قلبي ريحتك أنا فرشت لك الفرشة.
This is forward. We are waiting for the presentation. Good afternoon, ladies and gentlemen. I'm very happy to be here with you. Excuse me. On behalf of my organization, Timos International, I would like to kindly address sincere thanks to Saudi German Health for this kind and honoring invitation. So today I'm going to stress out the importance of quality standards and international accreditation in medical tourism. After all these fascinating pictures for these 8 segments of health tourism, we need to realize that the common element behind is the trustful healthcare system, the healthcare services which can be trusted and which are reliable for the medical tourist, but also for the regular tourist, right? So, the fundamental conclusions after 10, 15 years for medical tourism business is that medical tourism destinations have high quality services, prompt treatment availability, which means no delays for the medical tourists, and competitive prices. And at the same time, there must be a way to ensure a positive patient experience. In quality assurance, now we're discussing about the patient experience and the patient-reported outcomes more than what we used to discuss about patient satisfaction. So we will see that throughout the medical care cycle, the patient experience in this journey is very significant, very important. So, although these 3 conclusions might sound very simple, they have behind a prerequisite, the development of a national strategy for medical tourism. So, for medical tourism destination, we need to ensure that all these qualities are built up by the time. And first of all, it's the public and private investments in healthcare facilities, along with the touristic facilities and the hospitality infrastructure. So medical tourism is a VIP service, and the medical tourist has to be treated and handled as a VIP person. At the same time, there are organized strategies for quality and patient safety assurance. So patient safety is a very important matter. I don't know if you have noticed, but since 2017, WHO, OECD continuously publish reports on patient safety. And patient-related adverse events and safety-related risks are considered as the major hazard and the major threat for the sustainability of health systems nowadays. So another element is the centers of medical excellence expertise. So throughout the country, we should establish well-known medical facilities with high expertise and with proven evidence-based clinical outcomes. Clinical outcomes are those who drive the medical tourists to our country and to our healthcare facility. Another thing is, of course, international networking. I'm not going into this part so much. This is about marketing. This is about establishing a network with allied parties. Another very important part is the highly qualified staff. It was already mentioned by Dr. Fauzi, and accredited medical professionals according to international standards, and of course investment in continuous education for the healthcare workforce. So, medical tourism is a complicated service and has many different elements. And for all these elements and different functions, there should be standardized procedures established. There should be quality criteria to be considered. From the moment that the patient is still at his home country, where very significant decisions have to be made. So the selection of the medical tourism country, the destination country, the selection of the medical provider, the exchange of medical data for the treatment plan to be organized and arranged, the preparation, the physical preparation of the patient for the travel and for the on-site treatment, the pre-traveling arrangements and all the logistics that should take place. Then upon admission, we have the admission and screening procedures, and imagine how crucial this has been during the pandemic, the screening procedures based on, depending on the origin of the patient and the specific characteristics of the patient. So the treatment itself, it should be organized according to international standards of practice. This is very important to prevent adverse events and complications. And at the same time, invoicing functions, the discharge preparation, the fit-to-travel preparation. And in order to have the continuity of care and the optimum outcome for the patient, we need to have a pre-arranged follow-up process. We need to take care about the appropriate orders for the patient to be well recovered at his home country when he's returning back, and to have, of course, the rehabilitation treatment and the follow-ups and everything else that might be needed. So throughout this process that I have been describing to you, there are various risks. And the scope, the goal, is to mitigate those risks. So whenever you're hearing about the accreditation service and certification compliance assessment, all these aim to one single thing, to mitigate the risks. Not only for medical tourists, but for any patient, for every single patient that is treated in the frame of a healthcare system. So through the accreditations, we aim to protect the patient, and we aim to safely, let's say, handle all the special elements of treatment, of the treatment for the medical tourists and those patients which are involved and engaged in cross-border care. And this is not something that has been, let's say, pointed out in the frame of national strategies. Lots of medical tourism facilitators, mediators, and payers of the services pay significant attention to quality standards, and health insurance organizations are strongly demanding accreditation programs to be well established. Excuse me. And of course, these standards are appropriate in order to, let's say, provide evidence for a trustful outcome to the clinical practice. So, in a nutshell, major elements that we should consider. First of all, the qualitative and safe services approach throughout the medical tourism care cycle, the patient expectations, which should be somehow handled, and especially in medical tourism, we need to think about the individual perceptions, which are depending on cultural background, on the social background, on the previous experience of the patients. And of course, at the same time, we have involvement of different stakeholders, which should be somehow well coordinated. So the accreditation is a neutral, objective process for the assessment and evaluation of compliance of clinical and non-clinical services against compliance, quality, and safety criteria. So, a short introduction on TIMOS. Unfortunately, this is not so easy to handle. Okay, so TIMOS International is a German-based accreditation body. We have been working across the world for over 12 years. We are present in more than 18 countries, and TIMOS provides accreditation according to ISQA, IEA accredited standards. So our standards are acknowledged, and there is a specific competitive advantage of TIMOS. We were the first and unique accreditation body that have been focusing on international patients management. So we have a very specific part in the frame of our standards, which is about medical tourism and the essential qualitative criteria that should be established. So we have a big network and allied partners. We have recognition from different well-known organizations. One of them is the Diplomatic Council, which is a UN-registered organization. And Diplomatic Council acknowledges TIMOS International and provides a certificate, the Diplomatic Council Preferred Partner Hospital, to all the TIMOS accredited partners. So last but not least, I wouldn't like to miss referring to this exceptional cooperation which has been recently established, the cooperation of TIMOS International with GAHAR, the Egyptian national accreditation body. The agreement was officially signed on the 4th of April. And of course, the aim is to additionally qualify the Egyptian hospitals with all these elements of quality and safety for medical tourism. And of course, the prerequisite is at the first level, the GAHAR accreditation, and on top, healthcare providers will be assessed for the compliance against the TIMOS Excellence in Medical Tourism standards. So we are here, we're talking out of our experience. We love to be on site in the frame of the healthcare providers' settings and to, let's say, show the way to a safer care and to optimum clinical outcomes for the patients. I'm very happy to be here, and I will be very pleased to answer to your questions. Thank you very much for your attention. Thank you very much for being here today.
Thank you, Mrs. Angeliki. And now I am inviting Dr. Ashraf Ismail to have his presentation. Thank you.
I have a surprise for you. I don't have a presentation. There is one, but actually what we heard from Dr. Fauzi and our colleague today is covering a lot of things in the presentation, so I would rather share with you some basic thoughts which will lead to more discussions. First of all, thank you very much for all the organizers, for the Saudi German Hospital to host this, and for all those who participated in making this happen. This issue of medical travel is very, very important, and it is the time for it. Why it is the time for it? Because it becomes a fact. Medical travel is here today. It's not something we talk about it in the future. It is something happening every day, everywhere, for all human beings around this globe. For many reasons. Number one, that we do not stop traveling for many reasons. We travel for pleasure, we travel for work, we travel to stay in another country. We travel all the time. So this becomes our nature. The second fact is that diseases has become crossing borders all the time. There is no limits for diseases now. All epidemics has become pandemics, and it's not only communicable diseases, but also non-communicable diseases is traveling all over the globe, and we are suffering as a human beings from the same problems all over the globe. So this has become a fact. Number 3, advances in medicine and what happens in the advances of healthcare industry is not the property of one kind of people in a certain country. Advances in medicine is the ownership of the human beings. So when advances happens in Japan or Australia or South Africa or United States or Egypt, it is the property of the human beings. So every progress happens is our progress, and this consequently lead that the human beings should benefit from this. Where this service is geographically located, this is what we are going to talk about. This is very important to know that the world today as a planet has a lot of resources around this globe that we should share, and we understand that this is not limited to the people who live next to it. So having all this said, that we should realize that we have various kinds of people who benefit from medical travel. First of all, when we think about medical travel, we think about maybe tourism. We call it sometimes medical tourism. And this is given the sense that they are tourists who have medical problems. This is true. This is a big category, people traveling for tourism, and they have emergencies, they have medical issues during their tourism, so they have to find this kind of services. So this is a category that we should be prepared. If we are a touristic receiving country, we should be prepared to know what are the risks in our places and what kind of problem they are facing, and we should be ready with this kind of meeting those requirements. The second actually kind of travelers, also travelers who are residing in countries which is not their original country. We have in a country like Egypt, or any country of yours actually, you find maybe hundreds of nationalities living in the same country. Why we consider them medical travels? Because they have different needs, different languages, different cultures, different habits, different disease pattern, maybe also morbidities and comorbidities. So those who are residing in a country, they have also special needs. And the third category, which is very important to address and understand, that there are people who travel specifically to seek medical treatment, medical advice, medical help. They leave their country because for many reasons. Number one, maybe this kind of service is not existing in his or her country. So they are seeking a country where this service is existing. Number two, maybe the service is existed in the country, but there is a very long waiting list. And you all know that in England, or maybe in some other European countries, or even in the United States, there is very long queues, maybe a year or two, in order to receive some sort of a medical treatment or surgical treatment, especially for elective cases. So this means that people travel also to seek not to wait for certain, for a longer period. People travel because they are, the insurance does not pay this kind of service, and they would like to seek the same quality of service in a country, in a place where they can afford it and they pay less. This is another reason people will travel to to a place to seek this service. For all those reasons, people plan a medical travel. And this is something that people will think about where to go. And here they are thinking about 4 things. People who plan their travel, first of all, they are thinking about the quality of care they are receiving in the country they are heading to. And the quality of care here means that they will receive that quality that will yield the results and the outcome that they are looking for. They are not coming or traveling all the way to get no results or to get bad results. So the first thing is the high quality that will lead to the desired outcome expected by the patient. Number 2 is safety. Nobody will travel to any place unless they secure safety. That this is a place they wouldn't be harmed, they wouldn't hurt, or they will get another problem other than the one originally they are planning to receive treatment for. Number 3 is efficiency, is money, how much this will cost them. There is additional cost here. It's not only the cost of the operation or cost of the hospital, but the cost of the travel, the cost of the living of the family, the cost of being in another country. So the total cost is a big factor they will think about. Number 4, they will think about the patient-centered care. Patient-centered care here means a lot of things my colleagues has addressed. For example, if I am Arabic-speaking person and I'm going to China, what do you expect? What do you expect? I don't understand Chinese. Everybody around me is speaking their own language. I don't know what they are talking about. You know, this is very serious. So unless the language barrier is dealt with, unless the nutrition that Dr. Fauzi addressed, that people really are seeking patterns, different patterns of nutrition, so we have to be sensitive to this. Life habits, daily habits, sleeping habits. There's a lot of issues that the culture, different cultures need to deal with. So if we are really preparing to receive different cultures, different people, we need to understand and be culturally sensitive to all those variables in order to be able to manage those international patient and international travel. These are some important factors to consider when we are preparing for to receive medical travels. Now, the reason I am here addressing actually and stressing is the issue of accreditation and how accreditation is linked to medical travel and how it builds this trust that the patient is looking for. Patients, they don't know the details of the medical service. Patient actually is looking at the outcome, the result, but they don't know what are the details of the service. Accreditation here is an external evaluation as we define it, as we know it. It is a set of standards that hospitals and facilities should implement completely in order to pass this accreditation and to get this designation that they are accredited. The accreditation means compliance with the standards, and this is, especially if it is international accreditation, means that covering all those international needs, so this gives some kind of relief to the patient, to the customer, to the recipients of the service, that this hospital, this facility, this place has passed all the requirements for quality and safety, and consequently it builds this trust. Definitely the combination, for example, of Gahar, TIMOS accreditation that we developed, it combined both all the fundamentals, all the requirements for the hospital accreditation, and in addition also all the medical travel and the requirements for those international patients. So when the patient now and those who manage the patient, maybe the insurance companies or the TBAs, they see the result of this accreditation, they trust this is the place where they would like to send the patients in order to make sure that they are safe and receive high quality. The last point, actually, we talk about in this quick presentation is the centers of excellence, which follow the accreditation. Accreditation is a very good foundation. Implementing standards is very basic, very important. But what really the patient is seeking is the center of excellence where the patient is going to receive a particular treatment, trusting they're getting the best results. Like when I go to the best place to have cardiac surgery, for example, or knee replacement, or hip replacement, or cosmetic surgery, or name it, whatever the reason, ophthalmology, dental. Now, I should know that this center is characterized by being an excellent, by implementing the best guideline, the protocol, they have the competent staff, they follow the rules and guidelines every time, and they have designation also of a center of excellence. And by the way, Gahar is working now on developing standards for excellence, and these will be over and above accreditation, and this is going to be a very helpful tool and designation for hospitals that are going for this kind of designation for medical travel. Advances in technology is very important, and especially I will emphasize also the information technology and the advances in telemedicine. Telemedicine, as my colleague just mentioned, there is always sharing information before and after. Before, we can save a lot of time for those patients, and instead of coming and doing a lot of work out here, the investigations and all that, a lot of work can be done at your place, and then you send all this, and the diagnosis is confirmed, and then they come on site, they receive the intervention, the procedure, and then the follow-up also, you will be sharing a lot of information later on for follow-up and monitoring, and there should be ability to transfer medical records safely and securely, because if there is dissemination of information in a wrong way, this might be a big legal issue in medical travel. So sharing information is a big responsibility, should be done properly, should not be confused with any other patient, very good ID identification, and all the securities related to telemedicine. By the way, Gahar is now developing standards for telemedicine in order to complement also the accreditation. For those who would like to work on this area, they should fulfill those requirements for telemedicine. The last point I'm mentioning here is medical tourism is a total industry. It is not only a hospital activity or just a single activity. The whole nation is working together in order to have successful medical tourism industry in their country. It is cooperation between different sectors, starting from the embassies of these countries around the globe that facilitate visa acquired. Medical visas is a requirement. Should be easier and should be facilitated than any other visa, and this is very important. The travel and transport through airlines also is another very important piece. Receiving at airport and transportation is a very big issue in order to reach to the destination safely. And all the food industries related, all the accommodation related to the families and the companions. And in addition to this, the nice piece that everybody talk about it when medical tourism comes, maybe this family also need to see the country, the entertainment, maybe having some cultural tourism during the stay. This is also should be organized. It is a whole industry, the information industry also, as I mentioned, it is all working together to produce successful medical travel. Thank you very much for listening. I'll be more than happy to answer your questions later on. Thank you.
Thank you, Dr. Ashraf, for your presentation, for your speech. And now I am inviting Mr. Mohammed Al-Mihari to have his presentation.
بسم الله الرحمن الرحيم. السلام عليكم جميعا سعادة الحضور. معكم محمد المهيري مدير إدارة السياحة الصحية بهيئة الصحة بدبي. Today we will be talking about how to have a sustainable marketing strategy when it comes to medical tourism. Now, prior to jumping into that, what I would like to showcase to you is the impact of health tourism and how much money does it make for a country and how can it assist in developing that. And as you can see, there are 17 million travelers and it keeps on increasing by approximately 15% every year. That being around $4,000 to $7,000 being spent by each individual. And with the latest crisis of oil, prices have increased, so automatically those expenses would also rise with it. Now, when it comes to wellness tourism, we can see that the numbers are increasing year by year, and a lot of awareness has been created, especially after the pandemic. Now, each and every country presents itself in a different way and establish itself from a marketing perspective on what would they like to focus on. And as we can see, Germany and the United States are more focused on quality, it being in between Jordan, India, and India and Turkey, focusing on something that is moderate between quality-oriented and price-oriented services. Now, we come to a point where we as Dubai would like to club all of these services, as Dubai has been known for being a tourism destination that has been attracting almost 83 million visitors throughout its airport. And what we would like to do is invite those people that are, traveling through Dubai, showcasing to them what are the services that could be provided by the healthcare facilities that are available in the destination. And from our leaders' visions, we can see that each and every aspect of tourism has been developing within our country. And when it comes to health tourism, whether it's medical or wellness, His Highness Sheikh Hamdan bin Mohammed, the Crown Prince of Dubai, has initiated Dubai Health Experience. I'm just waiting for the slide to flip on. Hold on. Okay. So the initiation of Dubai Health Experience is to create a portal where each and every individual would be able to find what they're looking from a medical perspective. And we have our DXH group members. Part of them is Saudi German Hospital, where we are able to promote their services through our portals and showcase to people what services do they provide. Now, in addition to that, we work closely with all the stakeholders that are available within the destination, whether it being the tourism industry, transportation, the medical industry. We are able to club all of these services from a public and private point of view, where we can showcase a destination in the best possible way. Now, at the Health Tourism Department, we're focused on our brand, which is Dubai Health Experience. And as you can see, the department is responsible for strengthening the governance and regulatory framework of the health tourism services and the healthcare facilities and facilitators within the destination that offers health tourism services in the Emirate of Dubai. Now, our partnerships are extended to various partnerships. Our recent one that hasn't been announced yet is a partnership with Visa that would allow us to promote the destination furthermore with further discounts and offerings that relates to that. But it would be to a specific destination in the world. Now, how would I club all of those propositions to come up with a city offering and to stand out saying what Dubai has to offer? We're more focused on having a clear value proposition when it comes to being a health hub. We have most of the healthcare facilities around the city that are available for everyone and within their reach. We have a well-established connectivity when it comes to bringing in international travelers through our national carriers, it being Emirates Airlines or Fly Dubai. You're able to reach the destination as quick and as frequent as needed. We're focused also on the high quality, focusing on accreditation. Now, I believe that our esteemed panelists have talking about that a lot, and I cannot focus more or talk about it more to say how important it is to have the accreditation within a destination. And in Dubai, 95% of our hospitals are internationally accredited. Now, when it comes to choices, we have a variety of choices for every type of visitor to the destination, enabling them selecting the services that they would like. And we have a well-established resource when it comes to training. We have worked with Dubai College of Tourism to come up with a training program that would allow healthcare facilities to understand the ecosystem of tourism and how does it work, because everything is linked together. From planning the actual travel, reaching the destination, having the treatment, flying back, and certainly with the pandemic, I do believe that telehealth have come to life. Prior to the pandemic, we were not used to using a telephone for a consultation. But I think it is one of the services that would allow saving time and money while deciding on doing any types of services in a different country. We're also focused on, do excuse me, my glasses are a little bit dirty, and I can't see. So basically throughout our partners, we're able to grow those numbers of the healthcare facilities that are promoting the destination. And we have increased from 2014 having 26 healthcare facilities promoting the destination up to today reaching up to 95 healthcare facilities. Now, I do believe that this slide explains it all in a nutshell. We started with strategizing our aim and objective when it comes to promoting the destination, creating the brand of Dubai Health Experience, and working with the various partners around the world to enable us promoting our services in international events and all of the platforms that are available to do that. We have been ranked the first in the MENA region by Medical Tourism Index in the year 2020, and we are the sixth in the world. Now, as you can see in the figures over here, showcasing to you the actual surge and increase in numbers that are relevantly really high compared to the year before that, I do believe that the pandemic have assisted us showcasing the infrastructure of the health tourism in Dubai, and we have been selected as one of the top 10 safest destinations during the pandemic. I would like to take this opportunity to thank UPA, Saudi German, and Africa Health ExCon organizers, and I would like to thank you all, and please feel free to ask me any questions with our esteemed panelists. Thank you very much.
Thank you, Mr. Mohammed. And now I am inviting Mrs. Laila Al-Jasmi to have her presentation.
Assalamu alaikum wa rahmatullahi wa barakatuh. So, good evening, everybody. I know I'm the last, but inshallah I'll make it very simple. I would like to thank the Saudi German Health for giving me the opportunity to be here today. And I would like also to thank the African Health ExCon for the excellent conference. And I would like to congratulate you as an Egypt for having the first health conference for Africa in your region. Congratulations, and wish you, inshallah, all the very best for the coming years. I'm a UAE national, and I'm very proud to see such a tremendous conference, gathering all the people from the different Africa in one place. So today I'm going to speak about branding. We've heard from my dear colleagues, the panelists, about the importance of medical tourism and what is an added value. So I'm not going to spend time on that. But then how to become a medical tourism destination? What do we need to know? What do we need to do and brand this destination? It's very fast, by the way. Okay, so what is a brand? Is the perception. Is that how do you see that destination is talking about? So we all know, especially women, about branding and to have a brand quality of items. So it's usually how to perceive it. What do we think about the trust that we give into that brand and how we think of that brand is a value to us. So this is very much indeed important when you develop your brand about your destination or even about your hospital. Okay, so it makes you notice the brand, what you are talking about. It then how you are different than the others. We are all competitors in the region. Even if you are in Africa, you will be competitor to different African countries, as well as we are doing also in Asia. So how we will be different than the others? This is very much indeed important. Your customer is always going to ask you why you want me to come to you. So what's different things that you provide me that makes me come to you and recommend you to our peers or to my family and my friends? So what makes your brand, if it gets the perception and the trust, it will make you very easy to sell it out. Now, I know the word of selling in the business, especially in healthcare, it's not ethical, and people in healthcare doesn't like to hear the word of selling. But then when we talk from the business perspective, selling is very much indeed because you sell your service, you market your service. So this is very much indeed important to you. So what's the brand needs? Brand needs three things that they will rely on. Is that the reputation, the culture, and the product and the service of yours. So your reputation will develop your customer service. How the customer is going to perceive you and how they are going to recommend you and how they are going to talk about you to their friends, to their families, and even to their peers and to different destinations. And then you have to be innovative in your product. So whatever product you are going to sell or you are going to provide to your customer, it has to be innovated. We spoke about the different trends in the medical travel. One of it is digital health, telehealth. So these are all an innovative ideas that a lot of provider and destination, they became innovative in it when the pandemic has happened. And all of that started years back. We are so happy to know that there are certain destinations who had a future vision on investing on their IT healthcare infrastructure. So when the pandemic hit them, they've been able to tackle a lot of issues into telehealth, into the healthcare service where they provide telehealth, digital health, so the patient was not deprived from their healthcare provider. So these are some of the important concentrations and some of the examples of leading hospitals in the world. So it should evolve from the principle, as I said, of your business. For example, Mayo Clinic for them is that patient is first. Apple think different. So we have to have a short word that will determine exactly what we are trying to say to our customer. It shouldn't be a long wording or a long strategy highlighted. It's something that will tell who you are. First, build the trust, as I mentioned, and then deliver it to your customer. So, what the benefit you are going to get from building your brand? It will increase the preference and the trust. It will increase the value of the services, higher customer loyalty, higher company valuation. You've heard a lot in the business perspective, a lot of group of hospitals go to valuation. They get listed, for example, in a stock market. How do they do that? Is that they start how to build up the trust in their services, in their hospital, and the service they give to your customers through their developing of their brands. So all of that, it gets built up on the years. So then they get recognized in the industry. Then for them to go for valuation is so easy because they had developed the trust and the services that they've been providing over the years for their customers. And then increase employees' retention and attraction. And this is very much indeed important. We are all in the healthcare service, and we know that shortage of healthcare providers it's a problem and it's a challenge all over the world. So maintaining and retaining of the employees is very much indeed important. And this is all this being built up into your organization. These are some of the great examples that we have around the world of different brands that has been very successful in building their brand in the industry, whether it is hospitality, whether it is airline, or whether it is business, or whether it is a healthcare provider. So some of the leading brand in the medical tourism destination, and this is of Asia, with all due respect, my peer colleagues have spoken about Jordan and about Dubai, and we've seen that from the perspective of the Middle East. So let's look at Asia, for example. A lot of us knows about Thailand. We've heard a lot about Thailand. It's been a destination for medical tourism for a long period of time. And they had been building it for a long period of time. It's not a matter of a day or two. It's years. So they had a strong provider base. So we've heard this afternoon from how we can build the clusters of medical providers. We need to have the engagement of our stakeholders because it's very much indeed important because they are going to promote the brand that we are speaking about it as a destination. So they have been very successful in building certain unique excellence providers within their destination. So these providers became their ambassadors. They are the one who's talking about the brand that Thailand is trying to sell and attract the medical travel in. They focused on the quality, and the quality comes from different perspectives. One of it is accreditation, outcome of care that's been given to their providers, being able to emphasize into the testimonial of their different clients on their website, the reviews, what they have been talking about them. This is another one. It's Singapore. Singapore medicine is very well known also in the medical travel industry in Asia. And they have built up a strong healthcare system by also leading a provider. So you will see in the different destination is our providers, is our keynote speakers for what we are trying to build in our destination. So we have to build up that relationship and we have to focus on our provider. Each of our providers provide different kind of care. Some of them are center of excellence. So we have to promote them as a center of excellence. Some of them is a multi-tertiary specialty of care. So we have to promote them in that way. The emphasis on patient guide and advocacy, it's very much indeed important that we stress on the patient right and patient safety in our portal. Because as we knew, is that patient nowadays, I always say, treat your patient as an educated customer. Because now they have a lot of information available. They can read about you, they can know exactly what you provide, and they can compare you to other competitors. So treat patients with respect and that they are informative, not like ignorance customer. The last one is that the Turkish medical travel. We've heard a lot what Turkey has been doing, and that is something that they have invested a lot as a government and as a private provider. And this is very much indeed important. I always say, if you want to build a brand as a destination, as a government, you have to tie with your private stakeholder, because they are the one who are going to driven it. And it is very much important. We as a government, we as a destination country, we are there to facilitate the system for our healthcare provider in order to maintain and to flourish and to brand and to take it outside of our destination. So the information about the treatment should be available. If we can go one step and produce the outcome of care that's happening to our in our healthcare provider, that will be a great step to go ahead with it. And then effective marketing. You have to specify your target market. Where is your target market? I'm not going to go to any market. I need to know which market is going to attract the medical tourists to me. So I need to focus into that target market and take my brand there and market my brand there. This is very much indeed important when you develop your marketing and your medical tourism strategy. This is my last slide to share with you, is that some action points that you need to consider when you develop your brand. So executive branding workshop. A lot of us, we are not aware of how we can build up our brand or how we can guide our stakeholder into this brand and market and talk about it. So we have to do the workshop. It is very much indeed important we take them through the process. And then we need to assess, is our brand is right? Is the message we want to communicate to our target market or even to our consumer is right or wrong? This is something that we need to do. And then we have to develop after that the branding framework and the positioning, where we want to brand ourselves, where we want to be as a country of a destination for medical travel, where we want to be positioned in the world map next to us. This is very much indeed important. And then we have to translate what we are doing into an actual work. And then we have to launch the brand, and then we distribute our key messages to our consumer. So it's a step one-to-one that we need to do, and we need to walk the talk. And this is very much indeed important, because we always hear big messages and a big information that we need to believe in. But unless we walk the talk, it will never, anyone is going to believe in it. And then at last, as we do in all of our process, unless we have a measurable KPIs to monitor exactly what we are doing, we will never be successful. Thank you so much.
Thank you, Mrs. Laila, and thank you for all our speakers. I have learned a lot, actually, myself, and started to write a lot of questions here, but I hope you are not running out of time. Let's start with something, then we can go later with you for any questions you may have. This is a hot topic, and I think after all this rich materials that we have today, I think we can have a lot of questions to be answered now. Dr. Fawzi, you have mentioned you have started earlier in Jordan to have this destination branding and also medical tourism in Jordan. We know as a medical professionals that medical tourism is not just a pure medical service. We have something like 8 stakeholders involved in this industry, and be more than 40 destinations, 40 authorities get benefits from working in medical tourism. My question for you now, how did Jordanian government support you and made to just start in a powerful way for destination branding in Jordan?
Well, thank you, Dr. Asaad. Well, without the political will of any country, you cannot be a destination, because there are so many parties are involved in this. For instance, if you are a country that restrict entry to your country, you cannot be a destination. So the Ministry of Interior has to be on board. You must be accessible to other nations, other people to get into your country. Second, the government must be partner with you in your work, in laws and regulations. Private sector is the key player. The government is not the one who is providing the service. It is the private sector. So the government must empower the private sector. And how they empower the private sector? Well, first, the investment laws and regulations must be supportive to that. Second, you must discuss with the private sector what they need to succeed. Third, the government has an important role in monitoring. I am from the private sector, but I know that the government has responsibility on me to observe and monitor what I'm doing. Because at the end, this patient who comes from another country to your country and receive medical care, and he went home with a good result and he is happy, he will be your ambassador. So I think everybody must be in the loop, everybody must participate in a way or another. So it must be like public-private partnership to make this mission successful. Thank you.
Thank you. And this brings us a question now, maybe to Dr. Ashraf, regarding the regulations, if we can say that Dr. Fawzi informed now that the government can be like a control point for the health sector, especially that when we consider an international patient is traveling to a foreign country for treatment, the first questions he is thinking about, if something worse happened, if something bad happened to me in this country, to whom I have to complain, who can help me? So, do we consider the accreditation or the quality control of health system in a country could be like this, that I have to inform the patient, you can complain to me, this is accredited by me, and you can complain that I will investigate and give you the right, or?
It's a very good question. You keep holding it? It's a very good question. Thank you, Dr. Asaad. And I don't think we have a clear answer for this. In many countries, maybe we don't have this authority for medical tourism to be responsible for this kind of response. However, when we talk about accreditation, about, for example, GAHAR, or about international accreditation agencies, accreditation, as we define it, as we know it, it is the external evaluation by the organization that is independent, that is assessing the organization against certain standards and make sure they abide with the standards. This is accreditation. So we don't want to make sure, we want to make sure we don't give it more than what it is. And we need to know that this is the limits of accreditation. However, the regulatory part of this authority, and my colleagues can contribute to this, is playing an important role here. The regulatory part, which is played by GAHAR in our case, and in Dubai maybe there is authority for regulatory also, in other countries maybe a Ministry of Health, or it's their responsibility is to make sure that the healthcare is safe and there is no breaking of the rules of practice. And also our program in Egypt, for example, is the continuous compliance program with the standards, dictates that the hospitals continue to abide with the standards and implement the standards to make sure we have the safe and the quality care that we are, and if there is violations, and those violations sometimes due to negligence or due to reluctance or due to lack of competent staff who were not qualified, or any of those reasons, this might expose the organization to suspension and maybe to denial of this accreditation, and sometimes also to lose the licensing in case there is major violation. This applies not only to medical travel, but applies to anybody who is receiving care in this organization. However, again, this might be an eye-opener that for medical travels, it's also important for them to have an authority or to have a facility that really can respond, and this response should be quick and rapid to those, because maybe they don't know where to go in this country, and this might be an additional value to medical travel as well.
Thank you, Dr. Ashraf. And this brings me another question here to Mrs. Angeliki from the international point of view. Accreditation, of course, is well known in our healthcare industry. But what about the end user, the patient himself? He is aware about accreditation, what is the benefits of accreditation, how to choose this one against this one because this hospital or facility is accredited, or we are just talking in between us and nobody knows about what accreditation knows. I'm just asking again about your international experience in many countries.
Thank you for this question, Dr. Asaad. You know, it absolutely depends on the country that we are talking about, and especially on the way that the healthcare providers themselves have been using and branding and marketing the accreditation. So at the first level, during the first years of accreditation, it's mainly about the healthcare provider to starting establishing, you know, the benefits of the accreditation process, and of course to communicate those benefits and this competitive advantage of accreditation towards their clients and the patients. But by the years, the patients actually realize by themselves the difference to the service that is delivered. So the feeling, let's say, of safety, of security is being enhanced. So they are figuring out that this is strongly connected to the quality control that has been established to the hospital. If you allow me, I would like to return back to the previous question and regarding what we receive from the patient side. Trust me, we receive claims unofficially, or we receive emails by those patients who have to complain about something, or they have to report an incident, and then we, of course, directly communicate with, contact with the accredited partner, and we try to solve things out. I mean, to bring them together to discuss and further investigate about the incident. But this is an unofficial procedure. There is another function by TIMOS which serves in this direction. So we regularly review the critical incidents reporting system that has been established in the hospital. So it is essential during all accreditation visits that we go through the reporting system and we identify what has been occurring over the last years, months, or even years. And there is another mandatory element, the sentinel events, the very significant and life-threatening events that have been occurring, are reported mandatorily to TIMOS International. This is an international standard which has been recently established by ISCO accredited organization, so we do this also at TIMOS.
Thank you. Dr. Ashraf, please.
I'd like to add just one.
Yes, please.
After so many years practicing in accreditation, I would admit that accreditation is not a very popular word among the public. People do not know what accreditation is and what it is not. It took us maybe 20 years to get to the providers themselves and the professionals like yourself to know what is accreditation and what it is, what does it include, what does not include. So I think this is now a role of media and role of accrediting agencies, because most accrediting agents, they didn't do a homework to get to the people and tell them about accreditation. But it is the time, and we have our media people here, is really to get to the people and tell them what accreditation means to them. And this includes also the international community. When we reach them, when we sell these packages or market or brand, we should tell them, if this hospital is accredited, carry this stamp, what this means for them. This should be also active work. We should do our homework to reach to the people, to give this education. Otherwise, we should not assume that they know it and they know what it means.
I would like to add just an example
Yes, please.
of what does accreditation represent. In the tourism segment, you can see companies that is, or travel agencies or destination management companies that is IATA approved, meaning that you can book your trip through an approved agency that would ensure you are receiving that service. Accreditation acts the same way in the healthcare industry, ensuring that the patient is getting that service in the proper channel.
Thank you, Mr. Mohammed, for your addition. And this will bring me now a question here. When you start an industry with trillions of dollars, as we are telling about now, it is mouth-watering for those who commit fraud, who just jump on to take some money. How can we eliminate the fraud? How can we eliminate the disruption of the market? How we can do the control of the market from your experience in Dubai?
Well, I mean, if I understand the question correctly, when it comes to any type of corruption or fraud that is relevant to medical tourism per se, or is it something in general?
Medical tourism. Now, you told us about the Dubai Health experience, that you have members join this experience. What is the requirement to join, and how you control not to find somebody just by email selling the services and has no control about it?
So what we actually do whenever we actually receive an application form of being part of Dubai Health Experience, we actually, because we are the regulators, so we are able to check on the healthcare's background, whether there are any violations, there are any complaints, there are any malpractices that would, automatically eliminate the possibility of having such healthcare facilities. Now, that is part of the job, and I think what we're trying to do is ensure that such services are done through accredited facilities as well.
Thank you. Now my question to Mrs. Laila before opening. Yes, please. Questions? Yes, please. Okay. Please, if you have any questions, I think we have to go to the microphone. Or can somebody bring it to us, please? Yes, please.
أنا طبعا بما إن كل اللي موجودين في القاعة عربي، فأنا هتكلم باللغة العربية. يعني أنا اسمي وليد عبد السلام، أنا مدير تحرير القطاع الطبي في اليوم السابع، وبقالي أكتر من 20 سنة بشتغل في القطاع الطبي. عاصرت طبعا شغل وزارة الصحة والشغل اللي بتعمله النهاردة الدولة في منظومة التأمين الصحي الشامل، ودي أكبر منظومة تؤسس لنظام صحي كبير ومتميز ويتوافق بشكل من الأشكال الكبيرة جدا مع النظم العالمية. النهاردة أنا متصور أن احنا بنتكلم على التكامل الإفريقي والعربي في صناعة السياحة العلاجية. النهاردة أنا شايف أن مصر بتخطو خطوات كبيرة جدا نحو بناء صناعة السياحة العلاجية، وكان أول المفردات اللي وضعها أو اللبنات الأولى اللي وضعها دكتور أشرف إسماعيل بالتعاون مع دكتور أسعد رياض مؤسسة التيموس، علشان نبدأ ناخد الخطوة الأولى أو البعد الأول، وهو اعتماد المؤسسات لتكون متوافقة مع ما يسعى إليه العالم في اعتماد المؤسسات، وبالتالي السماح لتطبيق وتقديم خدمات السياحة العلاجية في الركن الثاني من المنظومة في مصر، وهو أن الدولة حاليا تسعى عفوا إلى تأسيس لنظام صحي يتوفر فيه كل الخدمات، مستشفيات على أعلى مستوى من الجودة، وهناك تدريب واعتماد للكوادر الطبية من ناحية، بلس الاعتماد المحلي اللي بتقوم به هيئة الاعتماد والرقابة الصحية، وبيقودها طبعا أستاذنا الدكتور أشرف إسماعيل. ولكن هناك بعض الأبعاد المهمة. لو أنا بتكلم عن المشاكل اللي بتواجه إخواننا الأفارقة علشان يجوا لمصر هنا، لأن احنا النهاردة بما ان احنا عاملين مؤتمر علشان أفريقيا والتكامل الأفريقي، أنا شايف إن أشقائنا العرب اللي موجودين معانا في الإقليم ما عندهمش مشاكل خالص إن هم يكونوا موجودين للعلاج والاستشفاء وما إلى ذلك. النقطة المهمة في الموضوع إن إخواننا الأفارقة عندهم بعد أو عندهم مشكلة في زيارة مصر أو التأشيرات اللي بتمنح من السفارات، سواء كان في مصر أو العكس في أفريقيا بشكل عام. وطبعا احنا في 2014 و15 و13 كان عندنا تعاون كبير مع بعض الدول الأفريقية، وهناك بعض التسهيلات لكن ليست كلها. المستخلص من الموضوع، أو أنا عايز أقول إيه بالظبط، حاجتين مهمين: هو بحث سبل توفير تأشيرة للسياحة العلاجية للأشقاء الأفارقة، وتكون بمعايير وبضوابط محددة علشان نقدر فعليا تقوم ركائز الصناعة على ما يطلبه الأشقاء الأفارقة. وأنا معلوماتي بتقول إن هناك احتياج كبير جدا لتخصصات طبية وعلاجية، وبتنفق أفريقيا ملايين الدولارات، قد تتجاوز 20 مليون دولار سنويا علشان السياحة العلاجية. وأنا شايف أن مصر الحقيقة بتقدم خدمة مميزة ومقارنة بالدول المجاورة. النقطة الثانية، أنا بستمع النهاردة لتجارب مؤثرة جدا زي تجربة الإمارات الشقيقة وتجربة الأردن، وأنا عندي معلومات مهمة وزرت الأردن وزرت دبي أكتر من مرة، واطلعت على مسارات تطبيق صناعة الصحة بشكل عام والسياحة العلاجية بشكل خاص، وفي خبرة مهمة جدا. أنا بطلب أن يكون في تزاوج ما بين الخبرات المصرية وما بين الخبرات العربية في هذا السياق. أيضا يكون هناك تزاوج ولو على سبيل المثال فيما نقدمه كدول عربية. يعني الدول العربية بتقدم سيرفيس وبتقدم عندها جودة وعندها خبرة في تخصصات مختلفة، ربما احنا ما نكونش متميزين فيها، لكن الحقيقة أنا عايز يحصل هذا التزاوج ما بين الخبرات المصرية والخبرات العربية الشقيقة، علشان في الآخر نطلع البرودكت المظبوط أو المنتج السليم، أو تقوم ركائز وصناعة السياحة العلاجية في مصر مع الأشقاء الأفارقة وفي نفس الوقت مع الأشقاء العرب. شكرا جزيلا.
شاكر جدا أستاذ وليد على المداخلة، هنعتبرها مداخلة لأن ما فيش سؤال بصراحة، لكن التوصيات طبعا مهمة جدا.
طيب ثانك يو فيري ماتش. أولا طبعا it's a very rich session زي ما دكتور أسعد كوريكتلي قال، وهو actually خطف مني my first question. So بس أنا هكمل على آخر حتة. I'm gonna look from the patient side. He mentioned دكتور أسعد and دكتور أشرف just elaborated على جهار. I think would we want to زي ما حضرتك تفضلت وطلبت من مستر وليد to sell the جهار to the public so that among the healthcare industry Gahar has quickly gained the respect of being a solid accreditation body and process, and everything will events اللي بتتعمل will future plans are known to us, so to us mean healthcare leadership and so on. But the public, when يعني I would love to see the time where the public would say والله this hospital is good but لا لسه مش Gahar accredited. I would trust more that hospital because it has the same specialty that I need, but it is Gahar accredited. So I think it will require from Gahar, nobody else has this interest except the leadership itself of Gahar to publicize to the public in some way using our colleagues in the media. I think it's very important. I would ask the second question to Ms. Angelica. You mentioned about feedback and the importance of feedback, of course, patient experience and so on. Do you have a standardized method to measure that? How do you do this? Do you do prims and proms, or do you depend on Press-Ganey, for example, and differentiate this?
TIMO standards define the goal that there must be a well-established procedure in the hospital, in the medical provider, to follow, let's say, the patient journey and to actually measure the outcome from the perspective of the patient. So patient-related outcomes, patient satisfaction should be definitely measured. And we also we review these results, these measurements during our accreditation assessment. But we don't really specify the tools because tools may be different. What we strongly recommend is that the tools which are used should be evidence-based and already used. So it is not a good practice to develop your own questionnaires or your own list of questions. You should use reference-based questionnaires either for patient satisfaction or PREMs or PROMs. So the tool is up to you, is up to the hospital, but we need to see actually that is implemented. And this is a problem. Usually we see very short, very small percentages on actually, measured outcomes, and we encourage the healthcare provider not only to measure the satisfaction, but also to make a root cause analysis on the complaints and on the outcomes to see the negative points and to actually identify the weaknesses which are hidden behind the negative results.
Thank you very much. Final question, small one to Ms. Laila. Now, you're promoting certain center of excellence or multiple one of them. Let's say we'd like to promote the liver transplant, one or more of the liver transplant centers in Egypt. So you go, when you go to that market, do you have to study that particular, what's happening in that market, so you tell the patients there, now your waiting list is a year or two or a half, and we have it. Do you study the local market of that particular specialty, or do you go that far?
Let me thank you for your questions, because it's a very simple and very specific, and it's an example. So thank you for that. Yes, if you are going to promote your center, you have to study which market first you are going to. This is very much indeed important. You don't need to reinvent the wheel, because you as a provider, your destination country has done already their research. So what you need to do is that you need to collaborate. You have to go to your governmental entity, whether it is local authority or whether it is a Ministry of Health or Ministry of Economy, whatever in your destination is marketing the destination as a medical tourism. They have all the resources available. So you just need to approach them, get to know which market is a target market. Let's say, for example, for Egypt, which is the target market for Egypt? 100% they've done the research, so they know which market is it. Then you just need to go to that market and promote your center of excellence. This is the best way. Let's say if your destination is still way far from becoming a medical tourism destination, or they are not interested in it, and you want to market your center of excellence, then you need to do the market research analysis. Yes, you are absolutely right. You need to study your market. Thank you.
Thank you. استاذنكم لان احنا ران اوت اوف تايم. لو في اسئله سريعه وهتسمحوا لي نكمل، محتاجين السؤال في 30 ثانيه عشان ندي فرصه لاكثر من حد يقول بسرعه. فلو تسمحوا لنا، لان احنا نعرف ان احنا اتاخرنا، لكن اتس هوت توبيك. دكتوره نجله وبعدين دكتور ابراهيم، بعد اذنكم اتفضلوا. بس يا ريت في 30 ثانيه عشان الوقت ويبقى عندنا فرصه نجاوب. السؤال في 30 ثانيه، الاجابه برضو لو قدرنا يعني ناخد وقتنا فيها بس اسرع.
شكرا يا دكتور اسعد، انا سعيده جدا بوجودي مع حضراتكم. انا الدكتوره نجله شاطه، استشاري اداره المستشفيات، وكنت وكيل وزاره الصحه في البحر الاحمر. انا بشكر حضراتكم طبعا على هذه السيشن، وهي من السيشنز اللي انا فعلا كنت يعني فيري باشنيتد ان انا اكون موجوده. انا بسال حضرتك دكتور اشرف اسماعيل ودكتور اسعد، هل ان احنا نحلم ان احنا يكون عندنا في يوم من الايام او الايام القريبه جدا يبقى عندنا سيرتيفيكيت للمستشفيات بتاعتنا اللي هي تراستبل اورجانيزيشن فور توريزم، فور ميديكال توريزم، يمكن انا مع الدكتور اسعد يعني في فترات ما كنا في البحر الاحمر شفنا قد ايه احنا محتاجين تنظيم السوق بتاعنا، محتاجين ان احنا نعمل البراند اللي قالت عليه الدكتوره ليلى، محتاجين ان احنا يبقى عندنا في شهاده غير الاكريديتيشن maybe بين الريجستريشن والاكريديتيشن something like this، حاجه تكون شهاده بتقول ان هذه الاورجنايزيشن trustable for treatment. احنا عندنا نوعين من السائح، سائح بيجي علشان اي نوع من السياحه وبيحصل له illness episode، او واحد تاني جاي for medical tourism. هذا السائح اللي بيحصل له illness episode يروح فين؟ ازاي ان احنا ندي هذه الشهاده؟ هل نحلم بان تكون هذه الشهاده سريعا تبقى موجوده في السوق المصري عشان ترتب لنا السوق بتاعنا وسوق السياحه والميديكال فيلد بتاعنا؟
هو the quick answer برضه in 15 seconds you don't need to dream، يعني مش محتاجه تحلمي لان ده بيحصل بالفعل او حصل بالفعل. The agreement between Gahara and Timus achieved exactly what you are talking about. Hospital that will get hospitals or healthcare facilities or centers or clinics or ophthalmology or dental that get Gahar accreditation will be eligible to receive TIMOS accreditation, which is abbreviated version, not the full version that used to be, and they will be certified internationally, as you mentioned, exactly for medical tourism. And then we will announce this to the world. And this is what we really need to answer your question also. We need to get to the people and target them and tell them we have this kind of facilities that provide those services under those international standards, and we should reach to the people everywhere and let them know about.
Thank you, Dr. Ashraf.
Thank you, Dr.
Dr. Brahim, and also in brief, please.
أنا معايا 6 أسئلة في 180 ثانية.
اختار منهم سؤالين عشان الوقت.
طيب دكتور فوزي، بس يعني انا عارف طبعا التجربه بتاعت الاردن تجربه كويسه، ما اعرفش حضرتك بداتوا من السكراتش ولا كان في سكاترد بازلز وانتوا عملتوا لها كونكشن توجذر بتوين الديفرنت سيكتورز. انا بس سؤال لحضرتك، ازاي نبدا؟ يعني لو هناخد ادفايس من حضرتك لمصر، احنا عندنا مجموعه من البازلز بتوين ديفرنت سيكتورز، مين اللي انيشيت، مين اللي ستارت، ومين اللي يليد؟ هل وزاره السياحه، وزاره الصحه؟ فاحنا محتاجين بس كده ادفايس من حضرتك للقصه دي. السؤال الثاني برضو، انتوا اتعاملتوا ازاي مع الداتا بروتكشن مثلا، القوانين المنظمه للداتا بروتكشن الخاصه بالمرضى الاجانب زي GDPR مثلا بالنسبه لاوروبا؟ وطبعا اعتقد الكومبليكيشنز كان الدكتور اشرف بيجاوب عليه.
طب نجاوب على السؤالين الاول؟
طب اسال الاسئله واقعد
هننساها يعني.
لا الدكتور فوزي كتب.
اتفضل.
طيب مس انجليكي برضو، can you just brief us about, I know that TIMOS surveyed a lot of hostels in even all over the world, so just can give us a best practices learned from medical tourism point of view to just be given us lessons to follow.
This is a long question. I have some objection.
يعني دكتور أشرف rephrasing للسؤال بتاع الدكتورة، when we can see the first edition of Gahar Excellence of Medical Tourism Standards. First edition, first version. مستر محمد، حضرتك ذكرت في الانترسكت سيركلز ان دبي in the experience focused, although 95% of the hospitals are accredited already. فالحته دي بس بالنسبه لي confusing، المفروض ان انا الكواليتي تيجي الاول وبعد كده الاكسبيرينس تيجي بعدين.
ممكن بس اوضح النقطه. In the 3 circles that you have seen quality focused, and then price focused, and then experience focused. صحيح. But what you can see in the circle below is that Dubai is trying to provide all.
أنا شفتها في الاكسبيرينس focus.
So you can see like a distinguishing between, like for example, you can see Jordan in the middle between quality and cost. We are linking all 3 together, and this is what we're trying to provide as a government to the people that are visiting our destination.
تمام. مس ليلى، اخر سؤال برضه ليسون ليرند فروم البراندنج من الاكزامبل اللي حضرتك ذكرتيها، تركيش والسنغافور والتايلاند، فروم براندنج، ازاي الناس دي عملت براندنج لنفسها، وحضرتك فروم براكتيكال بوينت اوف فيو تادفايس اس ازاي؟ شكرا.
اشكرك، ولو ان الاسئله دي لوحدها محتاجه مؤتمر مخصوص يعني.
ما هو حق الدكتور أسعد، لازم نبدأ من أول وجديد، فلازم نعيد المؤتمر. هلا كيف تبدأ في مصر؟ يعني بصراحة هذا بده زي ما أنا حكيت، يعني لازم يجتمع القطاع الخاص مع القطاع الحكومي، وكل المعنيين يكونوا موجودين على الطاولة وحط خطة استراتيجية. يعني مثلا ذكر الأستاذ موضوع التأشيرات. لا، أنت كمستشفى ما فيك تعمل إشي، وزير الصحة ما في يعمل إشي. هذا بدها قرار سياسي على أعلى المستويات. يعني إحنا جلالة الملك تدخل شخصيا في موضوع الجنسيات المقيدة، بدك أعلى من رئيس الوزراء كمان. يعني في مصر بدك الرئيس، لأنه هذا قرار أمني سياسي يشكل تحدي للأجهزة الأمنية. أنا أحكي بصراحة يعني. فأنا أعطيتك مثال واحد وقيس على ذلك باقي الأمور، وبالتالي صعب جهة واحدة هي التي تقوم بهذا العمل. الداتا بروتكشن اوف كورس، أول شيء قانون الصحة العامة يحمي معلومات المريض. اثنين، إذا أنت مستشفى أكريديتد، الأكريديتيشن في عندك البيشنتس رايتس والبيشنتس بروتكشن، وكل المعلومات هذه المفروض أنها تكون بروتكتد. وبالتالي بغض النظر أنت مريض يعني مصري ولا مريض أجنبي جاي على مصر، your data protection must be there whatever السيرفيس اللي أنت قدمتها. إحنا مشكلتنا بموضوع الأونلاين إلكترونيك ميديكال ريكوردز، مع انه كل العالم رايح على الالكترونيك ميديكال ريكوردز، ولكن اللي عم بيصير الهاكينج، وشفنا تجارب صار في هاكينج لمستشفيات كبيرة في أوروبا وفي أمريكا، والداتا تبعت المرضى was leaked. بس هذا beyond your capacity، ما فيك تعمل فيه شيء. you must do your best انك تعمل protection، تحط firewall، تحط انتي هاكينج سيستم، انتي فيروس سيستم، انك تحمي معلومات المريض. otherwise ما فيك تعمل اكثر من هيك. unfortunately true، حصلت. هي هذه زي ما انا حكيت، يعني انت ما بقدر جهه واحده تتحملها.
لو تسمح لي، شكرا دكتور فوزي. لو تسمح لي دكتور ابراهيم، بس اضافه بسيطه. احنا عندنا في مصر قانون لحمايه المعلومات بالفعل اقوى من الجي دي بي ار، بحكم شغلي يمكن مع عشرات شركات التامين اللي بره، بس يمكن احنا اللي ما عندناش اويرنس بيه، لكن هو فعليا اقوى. ما فيش نفس الغرامه اللي موجوده بره، لكن من ضمن الريجوليشنز اللي بتبقى موجوده ان انت بتعمل لايبيليتي انشورنس للمستشفى تو افورد لا قدر الله الفاين او الغرامه اللي ممكن تتعرض ليها. اشكرك. كان لسه في اسئله هنا تاني. مسز انجليكي بليز.
Yeah, I think there was also a question for me. So we are definitely exchanging best practice experience. And this is a very strong point for TIMOS accreditation surveyors and the whole process. We do not tick boxes. We do not just checking compliance. We try to provide, let's say, support to find best solutions to the different matters, different issues that we encounter. And of course, especially concerning medical tourism delivery of service, we have specific standards which guide in practice the healthcare provider to provide, let's say, the optimum results. And for data protection, there is a very strong framework. We have, of course, TIMOS includes such standards which are based at the GDPR, which is the General Data Protection Regulation of the European Union, and is adjusted, of course, for its implementation to the various countries.
Thank you. Any other question? Yes, please. If you can just in 30 seconds.
Where psychiatry fits into the global arrangement of specialties. Will there be psychiatric tourism specifically with its risks and potential power to destigmatize people travel in order to get healthy? But then there's also the other component of collaborative rather than competitive branding. So would we consider, مثلا, Egypt is going to be the center of branding for medical tourism in liver transplantation or cardiac surgery, whereas Tunis will be something else and South Africa. So that we would be, rather than competing, we would be collaborating and assigning a top brand of tourism to a specific country so that we cooperate. Thank you very much.
Thank you. The question is for somebody or?
Yani I want to assure you that Gahar is working now on a special set of standards for psychiatry. Psychiatric hospitals will be accredited by Gahar, and over and above, this is definitely can be also accredited for international tourism. And psychiatry is a destination, by the way, especially in addiction treatment. And many people travel outside their countries to stay away in order to get treated, and then they go back in addition to some other ailments as well. So it is definitely a destination.
Thank you. Let's take the last question. Last two questions, please. Okay. Yes, please.
Let's make them 3.
My name is Dr. Ala Khashaba, quality consultant in Cairo University. I would like to thank all the panelists for the very distinguished session. Special thanks to my dear mentor, Dr. Ashraf Ismail, the one who introduced the actual quality in Egypt. My question is to Dr. Fawzi. You mentioned in your very good presentation about 0 waiting time. This was very eye-catching for me. So do you mean 0, meaning 0, no waiting lists, for example, for surgeries, no waiting time for outpatients? And do you mean this for the international travelers or also for your nationals? I mean, do you have a universal coverage, which we know that there is, it's very difficult to have a short waiting time, and you're mentioning 0 waiting time.
Thank you.
Thank you so much.
Thank you. Dr. Fawzi.
Well, thank you very much. I think waiting time, we mentioned that long waiting time can be a reason why patient leave his own country. And we know that, for instance, England was mentioned, so I will repeat that. The Prime Minister said that there are 6 million British people are waiting for surgery. So this is a long waiting time. Most of them are waiting for more than 1 year to do a knee joint replacement or hip replacement. When we say 0 waiting time, does not mean in minutes or hours, but at least if you arrive today, you can see your doctor tomorrow, not next month. So as much as possible, the patient who is coming from abroad doesn't have the luxury of waiting, because it will be costly for him to stay in hotels, and usually he doesn't come alone, he comes with his family, leaving his work. So this is what I meant, but this has to be applicable for both local patients and international patients as much as possible. When we mention Jordan as an example, we are talking about private hospitals and private clinics. We cannot compare what is provided in the private sector than in the government or the Ministry of Health. Of course, if you look at government hospitals, there is a waiting time. But I'm not sure it is not as long as what is happening in UK. Thank you.
Thank you. Dr. Hazem?
I would like to add just one point.
Please.
I think waiting time from a medical tourism point of view is something that is crucial and important when it comes to that. And even if we look at accreditation, they mainly focus on making sure that you get your service on time. Now, one of the things that bothers me is if I'm waiting for another half an hour or 1 hour for my appointment. Imagine a person traveling to a country to get a certain treatment and sitting there for an hour knowing that he will be flying after 2 days.
Thank you, Mr. Mohammed.
دكتورة هبة يوسف مدير السياحة العلاجية في الهيئة العامة للرعاية الصحية. أولا بشكر دكتور أشرف إسماعيل ودكتور أسعد رياض لإدارة السيشن بطريقة رائعة، وبشكر السادة الحضور. عندي 3 أسئلة بوجهها للدكتور أشرف إسماعيل.
3 أسئلة؟
يعني 3 ثواني.
يعني in brief please.
أوكي. أول سؤال، إيه رؤية حضرتك يا دكتور في موضوع يعني إنشاء قانون يحكم عملية السياحة العلاجية لمنع المداخلات السلبية من الوسطاء اللي بيتعاملوا دايركت مع المرضى واللي ممكن يهدد الصوره العامه للسياحه العلاجيه سواء في مصر او في الوطن العربي ككل. وهل نقدر برضو نوجه السؤال للممثلين دولة الإمارات طبعا في الصحة في هيئة الصحة الإماراتية، إزاي نقدر نتغلب على ده عندنا في مصر ونصدر صورة فعلا فيها كريديبيليتي للمرضى بحيث تكون الحكومة هي المتحكم الأول والأخير في سوق السياحة العلاجية. تاني سؤال بسأله، هل معايير السياحة العلاجية وتطبيقها معتمد بتطبيق معايير المستشفيات الخضراء اللي بيسعى ليها العالم حاليا؟ السؤال الأخير طبعا بوجهه للدكتور أشرف إسماعيل، إمتى نقدر نعتمد أول مستشفى لينا في هيئة الرعاية الصحية إن شاء الله في الفترة القادمة بعد بروتوكول التعاون اللي تم مع هيئة التيموس؟ شكرا.
شكرا على انك انت فتحتي هذا الموضوع. انا عايز اقول ان هيئة الرعاية الصحية في مصر يا حضرات حققت ما لا يمكن تحقيقه عالميا، يعني في خلال سنتين بالظبط او يعني يمكن سنتين وشهرين حققوا 100 منشأة صحية مسجلة ومعتمدة على مستوى الوطن كله يعني. فده إنجاز كبير جدا جدا. أنا اشتغلت في معظم المنطقة العربية وكان طبعا ليا شرف إن أنا اشتغل يعني في الإمارات والمنطقة كلها. والإمارات على فكرة نمرة 1 في العالم في عدد الأكريديتد أورجانيزيشنز، يعني سبقت كل البلاد التانية. لكن مصر الحقيقة في خلال السنتين اللي فاتوا من خلال هيئة الرعاية، وهي هيئة حكومية، استطاعت أن تحقق 100 منشأة ما بين مسجل ومعتمد. ده إنجاز كبير جدا الحقيقة. يمكن 30% منهم معتمدين والباقي مسجلين وفي الطريق إلى الاعتماد. ولكن المستشفيات المعتمدة حاليا في هيئة الرعاية الصحية تستطيع أن تقدم على الاعتماد بكرة الصبح، اعتماد تيموس، وهي دي في الخطة بتاعتهم على فكرة. يعني ليس لديهم أي سبب إن هم ما يقدموش، بالعكس we encourage them إن هم to go for it and to apply for TIMOS accreditation, which will give them this kind of international recognition in order to start to market and get the brand for هيئة الرعاية الصحية. ده to start with. بالنسبة للقوانين أنا مش يعني لا أحصر زي ما قال الدكتور فوزي وكلنا متفقين ان موضوع السياحه العلاجيه ليس حكرا على الحكومه او المستشفيات الحكوميه او المنشات الحكوميه فقط. السياحه العلاجيه كل الريسورسز اللي موجوده في الدوله في كل قطاعاتها امر مفتوح لها تماما، والقطاع الخاص سباق الى هذا وبيسعى الى هذا وقادر على هذا، فده مهم جدا. ولكن الريجولاتوري رول صحيح هو ده اللي احنا محتاجين ان احنا نemphasize، وقد يحتاج ايضا الى اصدار هذا القانون الذي ينظم حق هذا الميديكال ترافلر في الشكوى وفي الوصول الى الاثوريتيز علشان يقدر يحقق هذه الشكوى. فده يعني في المجمل للإجابة على سؤال حضرتك.
The last question, yes. The last question promised
Bullet
from
question.
Dr. Mazen Gadir.
Bullet question.
Sorry, Dr. Ashraf, have you finished? I'm sorry.
I just want to add on top of Dr. Ashraf's comment. Whenever we look at medical facilitators with the right rules and regulation, it is a complement to the healthcare facility that would allow them to promote your services and bring you more clients. Similar to the travel agencies, it's something that is, just as mentioned by Dr. Ashraf, it's an open business for everyone, and medical tourism needs to be set by rules and regulation.
Thank you, Mr. Muhammad. For addition, I think this answers also a lot of questions. The last question now.
Thank you so much. My question, Dr. Ashraf, maybe what's the role of research to become or to make the PPP, private-public partnership, into PPAP, مثلا private-public academic partnership in the area of medical tourism? And I just wanted to see your thoughts and maybe the panels as well.
Can talk about research in different capacities here. Definitely medical research and advances in medicine in general is going into the guidelines and the protocols and implementing the best practice, and we are taking very, very aggressive steps toward this. Of course, this all over the globe Now this is the trend, evidence-based medicine using those guidelines. This is very important because it is very important for the patient also to know what kind of protocol is going to apply to them. And this protocol and guideline is the best also legal reference for this kind of practice. Because if something goes wrong, we need something to make judgment against. Did you really follow the best practice? Did you follow the evidence-based? Brian, this might be a very good reason why we need to do this. The other part of
just the role of academia in general.
This is again also an area that everybody is emphasizing, the partnership between the public and the private, and the research definitely is open, and there are companies working in clinical research and in implementing this, and this is supported by the government, and the results are taken into consideration, and there is a law, I think now is issued to regulate the clinical research and to encourage and to regulate clinical research in universities. So there is such kind of collaboration already. I don't know if you'd like to add.
Yeah, I would like to add one point. Thank you, Dr. Mazen, even though you have mentioned it from the academic perspective, but I would like you all to think from the business perspective. I'm not, by the way, business-oriented. I've been in the government for 23 years, so I'm now working in the private sector. So I'm telling you from the perspective of the medical travel, it can be a very good initiative for a business perspective and to public-private partnership. So thank you, Dr. Mazen, for raising that point. You need to think of the destination you are in. You are in a very unique situation. You are in Africa. There is an African country who are deprived from a good quality of healthcare. So you have to see Egypt as a destination that can provide a good quality of healthcare to other sister African countries, which actually we in the GCC and even in Asia, in the Middle East, trying to attract those patients in. So the public-private partnership can actually be a good revenue cycle to you all and can help you even to furnish the existing service you have to a new service that your neighborhood country are being deprived of. And you can partner with your investors to grow the service that your neighborhood country is looking for. So the medical travel, actually, it's a very big industry. So it can also be a good opportunity for a good public-private partnership. Thank you for raising that.
Thank you, Mrs. Laila. I would like to thank everybody by name, if I can, to keep full attention till the end of our session of late time now. I would like to thank all speakers for their contribution for us today, and would like also to thank Saudi German Health for organizing this valuable session, and would like also to thank our country for this huge conference that I am proud of. Thank you all, and see you. Thank you.
Thank you, Dr. Ashraf.
Thank you, Dr. Asaad, for leading this session, and thanks for the speakers who we had the pleasure to have them today. Please remain in your seats, or